So, what options are out there in treating diverticulitis if you're not responding to antibiotics? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, and welcome to Digest This. I'm Dr. Liz Cruz, and I've got Tina Nunziato sitting right here by my side. Thank you so much for joining us. If you are one of our regular listeners, we love you, and we love that you have been on this journey with us, and we appreciate your loyalty and taking the time to listen to these podcasts. If you're a new listener, welcome. And please check out our library of podcasts. We've got over 350 podcasts out there in our library, dating back several years, but information that is always pertinent. So please check it out. So today is a special day because we have a special guest.
Yes. Hello, Tish.
Hello.
Thank you so much for joining us.
I'm so glad to be here. Very excited to talk with you all.
Awesome. So yeah, we wanted to invite Tish on this podcast with us because she is a woman who approached us. How long ago, Tish, was it that we started talking?
It was earlier this year. I think maybe about 6 months ago now.
Okay, 6 months ago,
All
yeah.
right.
So talk to us a little bit. We just want Tish to kind of tell us her story because it's a story that needs to be shared.
Yes.
With so many people out there that are suffering from similar things that Tish has been suffering from. So we just want her to tell her story, and then we'll kind of jump in with our journey with her as well along the way. So go ahead, Tish.
Perfect. So I actually had been dealing with some type of digestive issue. I didn't, of course, know what it was at the time, but for many years, I really thought it was normal to eat and then feel bad, or to eat and then a couple of weeks later have like severe pain. And I just didn't know what was going on. I'd gone to different gastroenterologists in the past, and just never really got any. I was diagnosed with like GERD. I had a couple of people, that put me on like proton inhibitors. So I took one of those for about 10 years and, got to the point where nothing was really working for me and I didn't know what was going on. And then about 2014, I found myself in severe pain. Matter of fact, it was Valentine's Day and my husband had planned this wonderful day for us and he was going to take me we were going to do breakfast, lunch, and dinner and different things in between.
Aww.
And I remember waking up that morning and saying, hey, do you mind if we just push to dinner? Push to lunch because I just wasn't feeling great. I didn't want to tell him. I didn't want to ruin the whole day. So I told him, hey, let's just try lunch instead. And by lunch, I was like, maybe we can do dinner. He looked at me and goes, what's wrong?
Aww.
Oh, my God, I feel horrible. And that was the first time we went to the emergency room. And it was the first time I was actually diagnosed with diverticulitis. I had no idea. I'd heard of diverticulosis because my mom had it, my dad had it, but I never really understood. I never had heard of diverticulitis. To be really honest with you, when the person who told me that's what they thought it was after doing a CT scan, I thought they were like a quack. I was like, no, this has to be something really big because I'm in so much pain. I just didn't understand it at that point.
Where was Tish, if you don't mind me asking, where was your pain?
It was in the lower left quadrant of my stomach.
Okay, which is actually the most common place for diverticulitis.
Right.
Okay.
Right. So yeah, I was so used to it. Of course, and my thought was like, okay, it can't be appendicitis. It can't. I was trying to rule out all these things, but since I had never really did any research, I didn't know about diverticulitis. I had no idea.
Mm-hmm.
And just to make a very long story short, over the course of, all these years since then, I had been to the emergency room, at least 12 times.
Wow.
I've been on antibiotics so many times.
Oh my goodness.
And I'd actually found a decent gastroenterologist, at that point, but I just felt like he was giving me the same thing. It was like, antibiotics, get a CT scan. And I was literally, I was at the emergency room one day and there was a doctor there who said to me, you know what, I don't want to do another CT scan on you. You're getting so much exposure to radiation, and that had never even crossed my mind that this was a problem, right? And, you know, it was about that time where I started doing research. So my search on Google was naturopathic gastroenterology. And for some reason, I don't even know if this is how you're, you know, you categorize yourself, but Dr. Cruz, you know, that's when you showed up on my search.
Oh, wow.
Yeah, and because I was just like, I'm tired of taking all of this medicine. I was taking so much medicine. I was taking so many antibiotics. I was getting all of these tests only to kind of go through it over and over and over again. And my episodes were happening more and more frequent. So I reached out to the office and got connected with Tina. And Tina was such a blessing. And at the very beginning, helped me to get some great supplements that helped me to start feeling better, start, you know, getting some of the other fillers and things that were in all of the other products I was taking out of my system. And to be honest with you, I started having some relief. I was always constipated as a result of my diverticulitis. And so just like some of the things that we switched over to, the better probiotics, the better electrolytes and things like that really started to help me at least have a little more regularity with going to the bathroom. I know you guys talk about this stuff on your podcast.
That's exactly right. Feel free. We talk about poop all day long.
That's right. Just go at it. Go at it, Tish.
So that was helpful, but as you know, I continued to have flare-ups.
Yeah.
I want to say, you know, from the time I reached out to you all and talked to Tina, probably I had about maybe 3 or 4 flare-ups after that.
Yeah. And that's where, and you and I continue to stay connected.
When did you guys connect?
Well, we connected earlier this year.
Okay.
But it was probably like 3 months ago where you know, because I'm always constantly following up with everybody who's taking our stuff. And, you know, Tish kept telling me I'm back in the ER. I'm back in the ER. I'm like, oh my gosh.
Wow.
So like that's when one night I said to Dr. Cruz, I was like, I want to bring up this patient with you. She's not our patient. She's just a wellness client, but this is what's going on with her. And then you told me what?
So at that point, because she told me you'd had how many episodes this year?
Yeah, this year I think we were at 10 this year.
Yeah, when Tina told me how many you were at, because I remember this discussion very well, I was like, oh my goodness, this poor woman needs to get to the colon surgeon right away.
Yeah.
That, you know, and then she told me that this had been ongoing for years, but that just this year in itself, you'd had so many bouts. That's a lot you've been through.
You had been to see the colorectal surgeon, but you had decided not to have the surgery, right, initially?
Yeah, because, you know, to be really honest with you, I was so afraid of having surgery, that, you know, that magnitude of surgery. I was and I mean, I really thought, okay, we can manage this with diet. I had taken everything from out of my diet. I mean, I was eating like water at that by this time. And I was really concerned about the surgery. So yes, I had seen the same surgeon who ended up doing my surgery. Actually, you all recommended it. Just happened to be the same.
Yeah, we recommended the same person.
It's the same one. That's awesome.
Done the consult with,
when had you seen the surgeon in the past? Not when we told you, but in the past. How long ago had it been?
It was in probably November of the previous year. So I had
just saw it.
We connected this week, so it had been about almost not quite a year, but it had been several months before that.
Okay.
Yeah.
All right.
Yeah, so you told me though, so talk to me about what's going on there in the colon that like diet and supplements aren't really going to help at that point.
Well, there's, especially with all the bouts. Tish, do you know if all of your bouts were mainly on that left side?
So they were mainly on the left side, but one of the concerns we were having is I was starting to have pain in my back. I was starting to have pain on the right side as well.
Okay.
I was told was an indicator that it was starting to spread, if you will, get worse.
Yeah, that's the thing, that with you having that many bouts of that inflammation, like it just, all of a sudden, it just becomes like this smothering inflammation. It's not just acute, but it's chronic. And when you've got all that inflammation going on, that's when you start running the risk of developing complications like an abscess, a perforation, which by definition, diverticulitis is really a microscopic perforation. But anyways, perforations, abscess. Also, with that amount of inflammation, you can develop what they call fistulas. where you start to develop like a little tunnel between the intestine and other parts. I mean, you could get a fistula between the intestine, your colon, and let's say your urinary bladder, or even your small intestine, or even a little tract, like a tunnel that develops between the colon and your skin, you know, coming out, like where all of a sudden you're draining stuff from your abdomen, you know, your vaginal canal. I mean, just you name it. There's so much inflammation, and the body is just doing its best to try to heal. And, you know, and some of these fistulas develop because it's just trying to like just get rid of the toxins, the pus, just trying to heal. And so it does whatever it needs to do. And so it just...
The body amazing.
Yeah, the body is amazing. But the thing is that with all that chronic inflammation, it's just not healthy to have all that in there. And, you know, just leads to the patient not feeling well, just kind of fatigued. There's always, you know, even in between the bouts, there could still be like low level discomfort, and just, you know, because you've just got something in there that's just festering.
So how much, Tish, of the colon did you end up having removed?
You know, it was a little over a foot. I don't get the exact amount, but I know it was a little over a foot of my colon.
Okay.
Yeah.
And you didn't need a bag or anything, right?
It didn't, and that was my biggest fear because, I mentioned my mom had diverticulosis, but she also had additional issues that required her to end up eventually having a
colostomy bag. Yeah.
And I know what that was like. We took care of her for many years, and I was so concerned about that happening to me as well, which is another reason I delayed even considering having surgery.
Sure. And it is scary, right? I mean, it just depends on how healthy the tissue is, because the concern is that if there's so much inflammation that sometimes if they reconnect the colon, you know, take out the sick part, the diseased part of it, and reconnect it, if the ends of the colon are not healthy, you could get leaks, you know. And so that's why sometimes they do have to put a bag, at least just to let things cool down. And then a lot of times they're able to go back and reconnect. But that is concerning. And, you know, I know the colon surgeons always have to disclose that. That's always a possibility.
Right.
Yeah.
I just think it's interesting because one of the things when eventually, most recently did have the surgery, when you're talking about all the possible complications that can happen, I remember him coming into the room, just to follow up with me and kind of talk to me about what happened. And he said to me, I remember his face, he said, it was bad. He said it was bad. We were so close, he said, that my bladder was almost fused to my colon.
Yep.
Yeah.
That's what happens. Yeah. Wow. That's
getting longer.
That is amazing.
Yeah.
Well, what an amazing, miraculous story, really.
Well, and how are you feeling now? How long has it been since the surgery?
I had the surgery exactly 2.5 months ago.
Okay.
Yeah, and I promise, I feel better than I felt in a decade.
Aww.
And I didn't know it. You know what I mean? I didn't know I was feeling so bad until I started so good. So my recovery was extremely fast. I felt better, probably faster than I expected to feel better. And I'm not reintroducing like everything I couldn't eat, but I'm able to eat more food right now, and just feeling amazing.
Awesome. That is so awesome. I'm so happy for you, Tish. And I've got to say that your body. I mean, you have to thank your body, and if you believe in God, you got to thank God because your body was working so hard to try to heal you, because the fact that he said it was so close to fusing with the bladder, but yet it didn't happen. And imagine you've been having these bouts for years, over almost a decade, right? Yeah. And so that your body, what an amazing body you have, because your body has been working overtime to keep you as healed as possible, and not allow you to have any of these other complications. Because I've seen patients who've had just 2 or 3 bouts of it who've developed complications like what we just talked about. And so that's such a great story. And the other thing I wanted to point out, we tend to want to be as holistic as possible, right, Tish?
Right.
You were trying to be as natural, as holistic as possible, trying to avoid surgery if you could. But the reality is that in medicine, sometimes we have to use antibiotics. Sometimes there's certain medicines that we have to prescribe for certain diseases. Sometimes we have to get surgery, and so even though we try to be as holistic as possible and try to avoid as many prescribed medicines and try to avoid surgery, the beauty of medicine is that there are times when we will need a prescribed medicine or surgery, and it's wonderful that we have that available to us, right?
Absolutely.
Now, go ahead.
I'm sorry. I was just going to say there are days, even now, where I'm just overwhelmed with appreciation and joy and gratitude to God, because you're right. This could have been so much worse.
Mm-hmm.
And I'm grateful that He kept me, that He was able to prevent anything getting worse. And I'm really grateful that He connected me to you all, because, somehow your name came up on that search. And it really did. It changed everything, because the recommendation of you saying that I should really consider the surgery was the thing that made me shift. I sat and talked with my husband, and we said, let's do it.
Mm-hmm.
I don't know that I would have done it had you not made that recommendation, so I really appreciate that.
Oh, you're welcome. And I just got chills when you said that. Seriously. I mean, thank you so much. That really means a lot to us. And, I'm just amazed that you have had such an amazing outcome despite having had all this going on for so many years. And so the question that I asked at the beginning, are there other options for someone who's having ongoing episodes of diverticulitis? So look, it used to be, I remember when I started when I did my training 20 years ago, that the thought process, the school of thought was that once someone had 2 or 3 bouts of diverticulitis, it was a no-brainer. We would send them to a surgeon for consideration of resection. But that has changed through the years, where it's not necessarily, a knee-jerk reaction that if you've had 2 or 3 bouts that you have to go for surgery right away. I mean, now the surgeons are a little bit more willing to hold off and just kind of see how the patient does. And, I think a lot of it depends on, how far apart the bouts are. I mean, and you had several bouts just in this year.
Yeah.
Mm-hmm.
So that tells me like your body was just like ready to get rid of that. It really was.
Yeah.
And yeah.
Awesome.
Oh, one more thing I wanted to say, Tish. I just want to make sure that you are taking your probiotics faithfully, because you've been on years of antibiotics.
Yeah.
Yeah, and so I would just say never stop taking your probiotics, because
I will never.
Good.
And the enzymes as well. The enzymes have been extremely helpful too, but I will always take the probiotics.
Okay, good. I just want to make sure. Okay, so Tish, is there anything else that you want to share with our podcast family?
I just want to, if you're having issues, especially anything similar to what I've described, don't let the fear basically cause you to possibly create something worse. I'm so glad that I was able to come through this successfully, but if I would have stayed in that place of fear, who knows what could have happened. So talk to the doctor. Don't wait, and I think on the inside we tend to know that it's time to do something more, and fear will sometimes keep us in that place of stagnation. So don't wait, talk to somebody and move forward, and I'm so grateful that I did.
And you know what? Thank you so much. I love those words of wisdom that you just shared, and you're right. I think that we hear that little voice inside of us, and sometimes we just don't, we just kind of not ignore it, but we're like, no, but so I love what you said. Thank you so much for sharing that, and thank you so much for sharing your story, and for being willing to be vulnerable and be open and share this, because I know that there is someone out there and maybe many someones who will be blessed by your story. So thank you, Tish, for joining us today.
Thank you for having me. It was my pleasure.
Absolutely. So if you'd like to connect with us, please you will find us on www.drlizcruz.com. You can go to that's the homepage that will lead. There's a little pink magenta colored button that you can click and schedule a free 30-minute wellness consult. So please connect with us if you're having any issues, or if you just want to connect with us, just to connect. We'd love to hear from you. And if you haven't rated us, please give us a rating. Give us a 5 if you don't mind, because that'll actually help other people like you and like Tish to find us. And lastly, if you have not subscribed to our podcast, what are you waiting for? Please subscribe. That way you will never miss an episode. So thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.